All right, so I think we are recording. Great. Um, so welcome everybody. It's really great to see so many of your faces. I don't know about you, but just like having the solidarity of seeing other people who are grappling with all of this is a huge help for me. And I'm excited for us to kind of share with each other today. I'm Andrea Wenzel. I'm an assistant professor at Temple University. I'm also a co-founder of this project called Germantown Info Hub. And I'm here with Jake. Jake, do you want to introduce yourself?
Yeah, sure. I'm Jake Nelson. I'm an assistant professor at Arizona State University. And I've worked with Andrea on a few of these types of things before. And when she said she wanted to do this, I was really excited to help out with it as well.
Yeah, so this is sort of a prequel to a pre-conference. We have double pre. For AEJMC, we're doing a pre-conference on August 5th on engaged journalism. And of course, it might be a virtual conference. We're gonna find out more details closer to time. But also we wanted to thank the people who are helping us to co-sponsor it. We have the Tao Center for Digital Journalism, Arizona State University, Temple University, Oregon's Agora Journalism Center, and Northwestern's Medill School of Journalism. And we're really appreciative of all of their support for us. And I'm hoping that the conversation that we start today can sort of follow us through to that pre-conference, and maybe we'll do some check-ins in between. We just kind of want to see what can we do to be useful as a convener of folks. Most of you have either been researching or practicing engagement as journalists in recent years, and the heart of all of this work is, face-to-face interaction so often. And so we wanted to take a minute to think about, as we think about building relationships with communities, what does that look like now that face-to-face is off the table? How do we continue to support this mission even in this current moment? And a lot of you are already doing this and finding really interesting ways to do so. And so we wanted an opportunity to share with each other, and also to hear from some folks who've been doing international health messaging and work and in the international sphere for a long time that I think sometimes in the US as journalists we might not be aware of. And so it'd be good to kind of hear about work that happened even before the pandemic that's being kind of taken forward with that. So our call's just gonna, we're gonna scratch the surface here, I'm sure, but I hope it'll give people ideas for people they want to connect with afterwards, potentially, people they might want to collaborate with. The way we're going to do this is we're going to hear from a couple of you about the efforts you're doing. And the people on this call, I would like to hear from so many of you. There's so many great folks on this call who are, if you look at the Google sheet to see what people are up to, and that's not even everybody, people are already doing amazing work. So we'll hear from three people. Then we're going to do a couple of we're going to break out into smaller groups, and then we'll come back together and you'll have some time at the end to network with each other and share personal messages to follow up. But just to get going, I wanted to welcome three people to hear their experiences, and we're going to be taking questions. So if you want to put those in the chat, we'll be trying to share those. We might call on you to ask them, but we're going to give you an opportunity to ask for questions in a moment. But we want to first welcome Ashley Alvarado, Director of Community Engagement for Southern California Public Radio, Mike Rispoli, Director of Free Press's News Voices Project, and Miles Smith, Senior Director for Programs at InterNews. So I'm going to ask the three of you guys to get us started and just share a bit about what you're doing so far to adapt your work to this crazy social distancing moment. And maybe Ashley, if you want to get us started.
Sure. So we're doing a lot. And right now we're working on a Medium post that I'm hoping to get out this week, if not early next week, that breaks down both some of the ways we've grown work we were doing before, but how we've also been pushed to experiment and to have that willingness to try new things and to fail at new things, but also setting the parameters for like what's okay and what's not okay. By that I mean really working to identify and meet information needs, but what's not on the table? How are we're doing everything we can to avoid extractive journalism, to parachute in, but instead to lead with service. And so one way we're doing that is, since 2016, we've answered voting questions. And that started as a project called Human Voter Guide that some people on the phone or on Zoom have heard about. And in 4 years, we've answered 1,000 questions that people have about the mechanics of voting. What's changed is that in the last 4 weeks, we've answered more than 1,100 questions personally that people have about COVID-19. And it's something where our managing editor, her dad's a doctor, and she started paying attention to this a long time ago. And in January, actually the weekend, so right before Kobe died, we launched a coronavirus Harkin embed on our site. So we've had it for a long time, but we were able to watch over time as sort of mild curiosity turned to concern, turned to really really uh, I knew the 5-year-old was going to show up behind me at some point, which is what I'm saying now. But to fear, and we pivoted almost everybody on the engagement team to answering those questions. We adjusted schedules. One of the challenges of switching to working from home was also adjusting our schedules to meet information flow. Our governor and our mayor really like to have 5:15 press conferences, and in a newsroom like ours, most people are signing off at 5:30. So adjusting, and for that first week and a half, I felt a lot like I was back in managing a restaurant and trying to stagger shifts to meet the need. But we've developed a lot of processes, and we're doing more working closely with Harkin and some others to develop new kinds of workflows that'll help us identify trends faster and answer those questions faster. My colleagues on the event team have moved to holding events virtually, and one of the things that we've done is we've made our master list of questions and answers available to everybody in our newsroom, being very careful with privacy, but also wanting to make sure that we're sharing that information so that we have reporters who are not only trying to help answer questions, but are centering the question askers in the reporting, and then also building live events off of that. Something that I think is pretty neat is a couple of the folks that we've had come to us through Unheard LA, which is a live storytelling series we do that's community centered, have become the experts in answering people's questions about COVID-19. So we did a Q&A with Glenn Fernandez last week, and so he's an ER doctor and an opera singer. And so he had a really unique story he told it on Unheard LA, but then he weeks ago volunteered to answer the questions that we couldn't find answers to ourselves. And it's just a way that we continue to grow the relationships that we have. The last thing I'll say, because there are other projects, but I want to make sure that I'm not taking up too much time, is that Stephanie Rittopper, who is a member of the engagement team and leads our early childhood engagement, is working with a local designer who's also been part of events we've done in the past, Rostin Wu, to design this fold-out interactive mailer that will have an English and Spanish that will include activities for children and tips for parents that we're going to send out in English and Spanish to zip codes that have lower levels of internet access. And we'll be doing that. We're starting with a run of 10,000, but we're seeing whether we can get it higher.
Thank you, Ashley. Mike, do you want to jump in and share a little bit about what you've been working on?
Yeah, I can. And Andrea, you're sharing your screen right now. Didn't know if you meant to do that or not. I was just letting you know. It's all right. No one look while Andrea figures that out. So there you go. You're good. Cool. All right. Yeah. So hey everyone. My name is Mike Rispoli. I direct the News Voices program at Free Press. For those of you who don't know, Free Press is a media technology advocacy organization that organizes and fights for policy change to make the media system more just and equitable. So unlike some of you on the call, while I believe we work in journalism, we aren't necessarily like practicing reporters and journalists. And so the work that we do at the News Voices program is around organizing to build power so that communities have the news and information that they need. And that work has become especially important now during the pandemic. And so while a lot of attention has been paid on the importance of local news, as well as the struggles of local news right now, our efforts and focus has really been about focusing on communities who don't have access to the information they need due to systemic barriers like the digital divide, language barriers, paywalls, just in places where the local news crisis had hit before and there's no trusted local media outlet. And so while we think it's really important to be thinking about engaging with communities in online spaces, and I'll share one way that we've been doing that, we've been also developing tools and strategies to reach people who either the internet is, or broadband internet inaccessible or unaffordable, or for people who just maybe aren't comfortable engaging in digital spaces. And so two things that we have developed that we've been working in some of the communities that we've worked in New Jersey, in North Carolina, and Philadelphia over the past 2 weeks. One is hosting through Zoom, hosting virtual conversations with community members about their information needs, but framing it as what information do you need to stay safe and healthy in your community, and what stories can you share about your community's resilience? And then we've been collecting those, and then working with local newsroom partners to have access to those needs to help them figure out their coverage, and connecting people with journalists to tell those stories of resiliency. And then, so that's one way that we've been engaging with people in online spaces. Offline, which is where I think is actually where it's most important, especially if you think about the digital divide disproportionately affecting communities of color, even though the digital divide is usually focused on the rural communities. A lot of urban communities, communities of color, people can't access the internet either because it's unaffordable and inaccessible. And so, and thinking about how COVID-19, all the data is showing it's disproportionately affecting communities of color. So for us, it's really important to be focusing our efforts on that. And so we developed what we're calling a phone tree, which is more like a information aid network where we're organizing volunteers to call people that they know who either don't have access to the internet or wouldn't otherwise engage in these types of conversations, and asking them similar questions like, what information do you need to stay safe and healthy? Can you share some stories about your community's resiliency? And then we're creating centralized databases again so that journalists can then access that information, respond to questions, as well as community organizations being able to answer and respond to those questions and needs that people have. So we've deployed this so far in Charlotte, in North Carolina, in Atlantic City, in New Jersey, next week in Newark, in New Jersey as well. And then in the upcoming weeks, we're going to be collaborating with City Bureau in Chicago to launch the Chicago Information Aid Network, where they're using their Documenters program, who some of you might be familiar with, to be doing these types of calls with people. And so we're seeing already like how the strategy is being remixed in places. So it's not volunteer-led, it's just like existing people who are doing this work. And then in Philadelphia, we're going to be working with social justice organizations to be utilizing their phone banking lists, and who are already doing calls around mutual aid to be incorporating questions around information needs. It's really important for us to be thinking about how we're moving and working within existing movements and mutual aid efforts, and not necessarily doing something outside of the really great work that's happening in communities right now. And I would really urge practitioners of journalism to be thinking about how they can be collaborating with community organizations to reach people on the margins here, and not necessarily just rely on people coming to you or making additional asks of people during a time where they're already really stretched. Before I wrap up, just one thing that we found that was really, really interesting throughout the course of these conversations that I hope people begin to consider is that a lot of the coverage that's coming out of newsrooms is what we like to call like information that moves top down, right? Public official X holds a press briefing, journalists cover that, distribute it, right? So it goes from the top down to the bottom to the grassroots level. What people are saying their greatest needs are information that needs to move from the grassroots level on up. So like what is happening in community right now that can help inform policy making and decision making. That information isn't traveling as well because of physical distancing or because journalists or newsroom not having relationships with people in community. And people who are doing really good organizing needing to have their needs addressed or to be able to organize to influence those decisions or influence how policy or influence how aid packages are distributed, to find out any local abuses of power, landlords charging on rent even though there's a rent freeze, police ticketing people even though those things have been changed. There's no information moving from the bottom up or not as much as there might be. And so we really urge journalists to be thinking about how they can develop strategies to help information move from the bottom up, as well as thinking about how journalists can help information move within community as it pertains to mutual aid. We do get some coverage of mutual aid in local news, and that's important. I would really urge journalists to think about how they can be thinking about strengthening information as it moves within community, as well as from the bottom up, as you're thinking about how you're deploying your limited resources during this time.
Thanks, Mike. That's really helpful. Just the last person we're going to hear from us, this big group for right now, is Miles Smith from InterNews. I really wanted us to hear from InterNews because they've been doing work for decades on health information and international media development. And I'm curious to understand if some of the work that they've been doing can be useful for journalists, that we're not always, sometimes we think we reinvent the wheel, and there might be some things that we can learn from what's been going on there.
Thanks, Andrea. Definitely. Again, I'm Miles Smith. I'm the Senior Director for Programs at InterNews, and in that role, I'm overseeing one of our projects that's directly responding to the COVID-19 outbreak in Asia, working with humanitarian and health information responding experts that we have to work on the problem there. And actually, a lot of this stuff is pretty similar to what you've been talking about. Maybe I can put a bit of an international twist on it. But a lot of the points are the same. It's about making sure that you're really listening to your audience, making sure that you're not just telling them what you think they should know, or what authorities think they should know, but what people are actually asking for. And a lot of the challenges that Mike was just talking about have been similar or even more pronounced internationally, where the WHO or the local government is happy to call up the journalists and tell them their talking points, but they're not there to answer the phone or answer their emails when the community has concrete questions. So when we're working with our partner organizations, who are generally small to medium-sized independent media outlets based in developing countries, it's hard for them also to pivot to this type of reporting, to pivot to, are you producing news you can use? Is this information that people could actually use to improve their day-to-day lives, to help them cope, to help them survive? The media internationally and in these smaller communities, they often think, well, it's the Western media or the big media house in my country is talking about this, it must be important. And then they might go down the path of investigating a conspiracy theory or the geopolitical implications of the US and China in the context of this crisis, when most people, even the most sophisticated consumers of information, want to know news you can use. Like, if I go to a hospital, is it well equipped? The government promised to provide testing. Is that in place? Where can I get a test? What if I don't have insurance? Would I have access to free care if I test positive? Where can I go grocery shopping? Who has toilet paper? Like, all these are the kinds of questions that people actually care about, not the ones that necessarily are coming out of official channels. And this is actually a great opportunity to teach these media outlets to do this permanently. And they're very used to covering geopolitics. They're very used to covering, as Mike was describing, taking a press conference or a press release and converting that into a news story and posting it on their website. But they're not as good at bringing information up from the grassroots. And this is something that we're constantly working with them to improve upon. The project that we're running directly with our own staff to respond to COVID-19 uses social media analytics and our information ecosystem analysis methodology to find people who are being left out of the traditional information flows, who are misinformed or poorly informed by official government information and the official media. One example of this is in Bangkok, where we're working with migrant laborer communities who have come in from other countries in the region, from Burma, from Laos, Cambodia. They speak a different language than Thai. They tend to be on the poor end of the spectrum. Their information ecosystem revolves around social media or the friend and family networks that are connected back to their home country. So they don't actually have great access to contextual information locally, and they're at very high risk of becoming disease vectors because they often still have to go to work. They have less access to sanitation than the average resident of the city. So that's the type of folks that we work with. We partner up with local nonprofits who have connections to those communities. We find people within them who are willing to be key informants. We do different survey methods, such as we developed a chatbot that plugs into Line, which is the popular the popular texting service that the migrant community is using in that city, to do question and response in an automatic way so that we can pull in reams of qualitative information from members of these communities across several different languages. We have a product called Humanitarian Dashboard, which is really just a database and a workflow management system for taking in information, feedback, questions, and comments from the public, and then sending that information back out to WHO or public health agencies or media outlets who can then act upon it. And that's a big part of what we're doing directly. One other lesson that I think is important is that we meet people as we are, as other people have said before me. We adapt whatever we're using to communicate out to them to the methods that people want to consume information. And then when we do that, we find third-party validators to validate and speak on behalf of the facts. If we understand that in a lot of communities where trust in the government is low, where people have not been receiving services they expect, you need to find a credible source that can speak up on behalf of the evidence and behalf of the facts. So we have an Ebola response project in the DRC and in South Sudan, where we're working with community leaders, elders, religious leaders. We bring them into community radio stations to deliver the message that public health authorities are failing to get through to people in languages they understand from a person that they trust. You back that up with reporters and with health expertise, but you don't expect people to just take it credibly because it's coming from an authority figure. So that's where I'll leave it for now, and looking forward to questions.
Great. This is, I mean, I know we're trying to cover so much in such a compressed amount of time, but I want to open it up to questions from folks. If you want to, share things in the chat. I saw there was a couple of questions already about platforms. I think, Ashley, you gave a couple of tips about using Zoom to go to YouTube and things like that. Did you want to just quickly summarize that so that folks who maybe didn't see that?
Oh, sure. I'm definitely not the technical expert, but what we're doing is we're connecting Zoom to Facebook Live and live stream, and then through live stream to YouTube, so that we're able to reach people on their platforms of choice. And it also helps us be a little bit more protective of those participants, so that we're not having people jump into the Zoom feed. But it's definitely something that we're learning as we go to a certain degree, and it's been interesting too, where we have audiences that are used to coming to our events in person, and that learning curve with even Facebook of knowing to unmute audio, or knowing that they don't have to have a Facebook account to participate.
Knowing
so
not to accidentally share your screen, for example, things like that.
Little things.
This is, and I think we're going to have opportunities to keep sharing these lessons as we're learning them. I appreciated that all of you were sharing a lot of the same principles that have underlined engagement work, throughout, thinking about meeting people where they are, thinking about the needs and assets in your communities. I'm just curious if as you kind of went back and connected with communities to think about in this moment what the needs and assets are, were there assets that surprised you? Were there things that you're like, oh, in this situation, this is a really important, valuable thing that maybe I wasn't using before or wasn't connecting with before? So like, for example, in our Germantown project that, that Latrell mentioned earlier, there's a community radio station that we had not partnered with before, but in this situation, we're like, oh, let's partner with the community radio station and do a call-in show or something like that. Are there assets that you've kind of uncovered through this process?
I'll jump in real quick and just say, I think one of the things that we've experienced, and I was, we've been working to collaborate with community, ethnic, and language media partners around Census 2020 coverage. And one of, there's always that issue of making sure that you're meeting an existing need in offering a partnership and wanting to collaborate. And so for some newsrooms that hadn't yet signed our agreement and really come on as partners, it was the need for COVID-19 coverage that allowed us to really actually move forward in that partnership. And I had shared with our collaborations editor that when I had been at the Center for Investigative Reporting, we were doing all this work on earthquakes, and people, it just wasn't necessarily resonating in kind of like the pre-launch period. And then there was the earthquake in Japan, and things went from just sort of being hard to wrap your head around to a very real and present threat. And so that's one thing that has at least activated some of these relationships so that we can show up better for each other.
Oh, go ahead.
Can you just provide a couple of details? Because I'm particularly curious, how is it taking off now?
Danielle has worked on this with us. So this is also our check-in meeting. So we've had a couple of newsrooms that maybe they weren't doing as much of the census coverage, and so they didn't have as much of a need to collaborate. But they have communities that are very much affected by the pandemic, as we all are. And so we've now had Boyle Heights Beat come on as a partner because they want to publish essays by one of our columnists. We have Korea Daily coming on, and they hadn't been they hadn't participated much in any of the stuff that we were doing. And one other newsroom that's escaping me right now. The other thing is, it's just an opportunity, not that we needed another one, but it's keeping it present for us of understanding and celebrating the diversity that we have in our building. And so we have an investigative fellow who is from China, and she's been working with Chinese radio here, even though this isn't her beat. So this has become everybody's beat, and we're trying to be as present as we can be.
We've got a question from Andrew Haig. I'm interested in hearing what techniques Miles and others are using to sort through and make sense of a great deal of unstructured qualitative narrative input and feedback. Miles, do you want to share on that?
Yeah, that's a great question. So the humanitarian dashboard that I mentioned is a piece of software that we've developed on a grant from Citrix, which is almost done. Cisco, not Citrix, which is almost done and ready for prime time. And when it is, we're actually going to make it open source for people to use. But it's just basically a platform for taking in qualitative reports in Excel sheets that people could submit through phones, that our staff members could submit through phones after they do enumeration, interviews, surveys, that can categorize some of the information and make some sense of it. But it's always a challenge. It's not like it uses natural language, machine learning techniques to really understand the content there. So it's definitely a challenge for us. To answer the last question about unique assets, we're trying to find those now for this response, but one that came to mind when you mentioned that, Andrea, was what we were doing in Bangladesh for Rohingya migrants refugees who are in refugee camps on the Bangladesh-Myanmar border. We're trying to get audio clips of information to them because the Rohingya language is not written. Many of the population is illiterate on written words in any language, and so audio is the way to reach them. And what we ended up doing was working with cell phone credit charging stations and SIM card distributors who would give you a SIM card, or you could buy cell phone credit from them, and then they would provide the news update as like a free service that comes with your SIM card. So it was a way to quickly get information and get the update out to people without having to have a centralized distribution mechanism. And that was just a unique way of distributing information we found that we'd not thought of before we got there.
Thanks, Miles. I wanted to give Mike a chance to jump in about the previous question. He wanted to say something. Sorry.
Yep. I think it was a really good question thinking about assets, because I think the thing that we found surprising was that the assets were always there, and it was just a matter of whether or not newsrooms wanted to utilize them. And I think right now what we're seeing is some newsrooms pushing themselves and others kind of falling back into, like, you know, bad habits, old habits, whatever you want to call it. But I mean, the number one asset that any newsroom has around addressing information needs are the community organizations that are closest to this work right now. And I think it's a choice whether or not you want to partner and work with them during this time, or if you want to kind of retreat back into some old habits around determining what is newsworthy, or only relying on those official statements that we've kind of been talking about. And so I think when thinking about that, if there are a lot of ongoing efforts happening where you live, you can very easily reach out to those organizations and just see if there are ways for them to assess what their members or their constituents' needs are, and that you can either use that information to help guide your coverage, or you can directly reach out to them. And I think the places where we've seen this to be working are in communities where those relationships were already strong, in communities where you had journalists who weren't afraid to collaborate with non-journalists on story projects or things like that. And so if that is a situation where you are in, I would certainly suggest that you keep pushing that way, and just like not make it about how can you help me do my job better, but how can I as a journalist help strengthen your efforts in providing food to people, and providing childcare, and providing companionship to people who are isolated right now, whatever it may be. And really think about how your work can help people who are most impacted by going on right now. And I think if you're in a situation where you didn't necessarily have close relationships with community organizations, now is a good time to be thinking about how you can demonstrate the value of your journalism by partnering with them and by providing that service that I think many people in journalism want to provide in a time like this.
Thanks, Mike. There's a lot of really great questions coming in here. I want to give Tahid a chance he had a question earlier about that he shared in his Google form about impact. I want to give you a chance to ask that real quick.
Thank you. Hey, everyone. My name is Tahid Chappelle. I wear a couple hats here in Philadelphia. My main job is audience engagement editor for the Philadelphia Inquirer, and I'm also an executive board member of the Philadelphia Association of Black Journalists. We are the founding chapter of NABJ, and we work to diversify the media and empower Black community members and communities of color to tell their stories and find a better way to report about the issues that actually impact their stories, or their communities rather. Speaking of impact, one thing I wanted to talk about, or just ask to the group, was just measuring outcomes and finding out, what are you trying to get out of a related project? How are you measuring those outcomes? And how are you able to translate those outcomes to people where you're going to need to derive more resources and support to expand the work that you're doing? Can you kind of talk about how you're tracking and measuring, and how are you reporting so that you can get more support to continue the work that you're doing?
Anybody want to jump in on that?
Another tough question. I could try. This is Miles. one thing that we do on our international humanitarian work is, because so much of it is focused on very granular types of accountability. So are the officials delivering the things that they are promising, or are they adjusting their behavior based on interactions that we're facilitating? So for example, in Bangladesh, as I mentioned previously, where we were working with groups of migrants who were complaining about rightfully so, about the type of rice that they were being delivered by the World Food Program. It wasn't the type of rice that they were used to, and it didn't facilitate them cooking in the way that they wanted to. And it was just that they basically bought the wrong type, and they didn't talk to anybody about it. They didn't ask, what type of rice do you want? They just delivered something that they had available. And we figured this problem out that no one in the World Food Program knew anything about, and were able to show how it was a big deal to people, that there were a lot of comments coming through our system to get that supply chain changed. We would do the same thing with the type of blankets or the type of tents that were being provided, the type of infrastructure that was being provided. So it's not a final outcome per se, but it is an intermediate outcome that shows that at least the accountability aspect of the reporting that we're doing is changing the officials' behavior. And that's what we intend to do with COVID-19 as well on the Asia project, although we're just getting started, so we haven't gotten to the level of seeing those types of changes.
We're running a little short on time, so I want to give Michelle Ferrier a chance to talk about her Media Seeds work, her work in Southeast Ohio, which has come up as a response to some questions in the chat. Michelle, do you want to share just a little bit? We could probably talk for much longer than we have time for here.
Sure. I'm trying to look through some of the questions in the comments. So a couple of things, especially for those that are working in distributed communities or rural areas or things like that. The Media Seeds project that I did with Journalism That Matters in the Jefferson Center was based in Southeast Ohio, a region that has very poor broadband infrastructure, cell phone coverage, and access to information, and trying to look at how to build up these community info needs, specifically around healthcare communication crises. And so the work that I was doing a couple years ago really focused on both news and information, as well as the opioid epidemic that was hitting our communities pretty hard, and how we could get information out to communities. A lot of the conversation in the chat has focused on platforms. One of the key things that I learned working in these rural communities, working with marginalized communities, etc., there is no one platform. You've got to go and find out what platforms people are on and use multiple platforms to deliver the content in the same formats and repeated messaging, etc. It's really key to recognize that everybody doesn't have broadband access, everybody doesn't have Facebook, etc. And so I think developing a multi-platform strategy is really key to getting the information out right now, particularly in rural communities. That means partnering with radio, which is the one medium that people have during drive time, perhaps when they're driving back and forth to work an hour or so from the rural communities back into cities and towns, and getting them access to the information they need through the phone as well. The other thing I would recommend, somebody here says laundromats, grocery stores, gas stations, whoever you can partner with to put up visuals, flyers, etc., directing them to the online conversations that you may be having, or the content is really important. Some other folks have mentioned working with proxies in communities, and I think, for to a certain extent, those are good to begin to identify some people. So whether those are the nonprofits, whether it's the small businesses and other people that you're working through to get to the information. But ultimately, I think each of us needs to do our own work to build that cadre of people. And that includes diving into kind of our sociology bag of tricks and using ethnography and other different types of reportage and other types of reporting to be able to get the stories out about what's happening in these communities. I hesitate to use proxies all the time to get initial entree, to have them introduce you to a community, etc. But to rely on them for information ongoingly, I think really bastardizes the relationship that you have with marginalized communities, and really distorts the voice of those people when it's filtered through the nonprofit organizations for whose paycheck and money and everything relies on them being able to demonstrate a positive impact for the work that they're doing. So not to say that I don't think it's important to partner with them. I think it's important to develop your own relationships using digital ethnography. Ashley mentioned postcards earlier. We use postcards extensively to get both health information as well as news and information out to the community members. It was a direct-to-door, direct mail piece that went out to communities using a postal system program called Every Door Direct Mail. I put a link to it in the chat box. It also describes kind of the ways to identify the communities, what their demographics and concerns are. And it also includes in there, for the person that asked about impact, a pre and post survey instrument that we developed that looks at media diet, so how people are getting their information. That'll help you determine what kind of platforms you might want to look at as part of your combo package. It also looks at community well-being and helping understand how connected people are to their community, how they trust people in their community, etc. And that instrument can be used and modified as a way to be able to measure how well you're doing in terms of driving people to new media sources, to the information that you have, and whether it's making a difference in helping build some social cohesion. Okay, that's it, Andrea.
Thank you. That's amazing. There's so much more we could talk about there. I'm so tempted to blow through our breakout groups, but I want to also give people a chance to talk with each other a little bit. So we're going to do a brief breakout session. There's so many great questions in the chat right now. Maybe some of us can try in our breakout sessions to address some of these. Fiona had a great question about community ambassadors, or what Miles called third-party validators. But that's something that's been kind of a running question and theme through several of your discussions there. There's some other great questions as well. I'd like you to also maybe think about, when you're talking with each other, to share how are you trying to find out what the needs and assets of your communities are, how they've changed at the moment, and how you're planning to adjust your projects or have already, if you want to share that a little bit with each other. And I'm going to try to do this without screwing it up, the breakout rooms, and then I'll bring everybody back in 10 minutes or less here, because I want us to have a chance to connect again. So let me try to do this. All right. Okay, happy talking. We'll talk back in a minute. Thank you. A quick wrap up here, and then we're going to leave this open for those folks who want to keep talking or connect with each other.
You've done fine, Andrea, at the facilitation on Zoom. It's gone fine.
Okay, thank you. I'm learning.
Yes, Andrea, you've done great.
Unlimited sleep at the moment with the new.
And the lighting is great for you too, Andrea. You look very radiant.
I'm sitting with a window in front of me, so.
Yeah.
She did not pick a virtual background, so that's great.
Oh, all right. Well, thank you guys for humoring me. But really, thank you for sharing with each other. And this is, I mean, I really wanted to hear everybody's, but it's such a difficult moment, and you're all kind of like embracing what you can at this time. Did any of the groups want to, I neglected to say each group should maybe take some notes, so that I'm sure it didn't happen, but if any of the groups wanted to share a couple of quick takeaways that they had, and they can also share them in the chat. I know we don't have hardly any time here, but any last little quick thoughts?
Andrea, I wanted to give a quick thought, because we did talk a little bit about proxies. And I don't know how many people really have created a very deep connection to the health departments in their areas. They are struggling as well. They have a federal mandate to get out this kind of information in the communities, and they are not experts about communication with communities. So I would say if you were looking at and have not already established a deep relationship with your county health department, etc., and trying to find ways to connect with them and help them in assisting in getting this information out, I think that would be a great first step.
Thank you, Michelle. I see a lot of good thoughts in the chat, a lot of ideas and people sharing stuff. We're going to try to save the chat function and share that with you, as well as the video. We'll circulate around like all the resources that you're sharing with each other. A few of you also seem to be interested in maybe doing a follow-up. So Jake and I will kind of try to touch base with you and see what might be useful in that regard. Please get in touch with us and let us know if there's things that you think would be useful. Any last thoughts or shout outs that anybody wants to share before we wrap up our all together time? We're going to leave this open till like 1:30, and you can keep messaging each other if you want. But I wanted to just respect everybody's time. I know everyone's like juggling raising small children and work and everything else. So
thank you, Andrea.
Thank you.
Thanks, Andrea. This is great.
Thank you, and thanks to Jake, and thanks to all the people who've been helping us. All right, it's so great to see everyone. We'll leave this open. Send each other messages. Talk amongst yourselves. And thank you so much for sharing your day with us. Take care.
Bye.
Bye.
Thanks.
Hey.
I got to jump to my childcare duties myself.
Yes. I will too in a minute here. Jake, if you're on here, I guess I'm going to stop recording. Yeah?
Yeah, that sounds good.